one thing is to have something in your head. And second thing is to know where to get the information. Having a pharmacist you can call to ask questions is knowing where to get the information. Or having your phone you can browse. Or having a book you can look into is knowing where to get information. There are important books you can help you to know. Like something like there's a book called MDEX. I don't know if you have come across it. MDEX is a very nice book for Nigerian practice. It contains some drugs, their uses, adverse effect, contraindications, dosage, some of drugs that's common in Nigeria. So any practicing this thing in Nigeria should have MDEX. You can buy it to help you. If you read something in your textbook, or if they teach you something in a class, you can use it to compare how the drug is in real life. It will help you to grow more and grow faster. By the time you go to your second year doctor, they will ask you, where did you say you drink? Who taught you? Because you are learning. You expose yourself to learning. Have you seen why I started this? Because it's not in every class I will sit down and start talking like this. Because if I talk like this in class, we will not cover anything in class. Are you there? Yes. So now, as you're talking about this drug interaction, there are something I want you to know about drug interaction. There's what is called synergism or synergism. We have what is called antagonism. Antagonism. I am just telling you. I have talked about this now. When these two drugs come together, when these two drugs interact, or drug or whatever, other food or water in the system, any other thing in the system, interacted with the drug you are taking, and it helps to improve the effect of the drug, is called what? Synergism. You can say that they are what? If the interaction that occur when the drug, if the result that occur when the drug interacted with another drug, if the result is positive, that if it increases the effect of the drug, is called what? Synergism. Are you there? You know I told you that interaction can cause two things. It can cause the effect of the drug to come down, or it can even increase the effect of the drug. If the effect of the drug is increased, it's called what? Synergism. But if it is decreased, it's called what? Antagonism. It's called what? Antagonism. That means if the other one, if you want to express it, you say that this drug has a synergistic effect. Are you there? You say that the drug has a synergistic effect on this drug. Okay, this drug, okay. No, don't worry. You can take two of them. This one, no, don't worry. Fatty food. Or this drug has a synergistic effect on this one. That means it can increase the effect on the other one. But if you bring the effect down, you say no, it has antagonistic effect on this one. It will not be okay to use it. Are you there? But there's something I want you to know. No, if you are following me now, you don't understand. I'm coming out small, like a termite coming out from the hole. So if you are following me gradually and putting your attention, you see that this thing will be easy for you to understand. I started from drug interaction. I told you that drug interaction can be what? Drug food and drug herbs, and another, even any other thing can cause interaction. And I said that the interaction can be what? Positive or what? Negative. If it's positive, that means it increases the effect of the drug. If it's negative, that means it decreases the effect of the drug. Now, you see that if it increases the effect of the drug, it's called what? Synergism. You can say that this drug B has synergistic effect on this one. Are you there? Yes. But if it decreases it, you say it is what? Antagonism. That this one is antagonistic to the other one. Are you there? Yes. Now, in this synergism, there's something I want to point out. There's something I want to point out in this synergism. There's something I want to point out in this synergism. In this synergism, there's what is called, actually, if you break it down, there's what is called what? Additive effect. Are you there? Additive what? Yes. Now, you know that drug has efficacy and what? Drug has what? Efficacy and what? Side effect. Now, if they are synergistic, that means it increases everything, both the side effect and the what? Yes. And adverse effect. Everything is increased. Are you there? But if it has, okay, let me read what I have here. In synergism, a potentiation, that is an increase of the effects of one drug, is the potentiation or increase. The potentiation means increase of the effects of one drug by another drug. Is what? Synergism. But another thing there, this potentiation may relate to both therapeutic and what? Toxic effect of the drug. So it can increase every. But there's another one called additive effect. Additive effect is when a drug contributes to what? Therapeutic effect of the other drug. That means additive effect is focusing on only what? Therapeutic what? Effect. Are you there? Only on what? Therapeutic what? Effect. But synergism, additive is a form of synergism. Are you there? Okay, let me put it in our normal language. All additive effects are synergistic.
Okay.
Effects are what? But not all synergistic effects are what? Additive. Are you there? Are you there? Additive effect focuses only on the therapeutic effect. Are you there? But synergism, it increases every. Are we there? Who is not with us? Tell me. Who is not with us? I said that two of them in synergism and additive effects, they are positive. But remember that a drug, we have positive, we have therapeutic effect and the side effect, toxic effect or adverse effect, as the case may be. But the synergism increases every. Both as it's increasing the therapeutic effect, it also can increase what? Side effect. But additive effect only focuses on what? Therapeutic effects alone. Are you there? Are you there? Now, I now put it in a language, in a spread language, and say that all additive effects are what? But not all synergistic are not what? Some synergistic effect can be what? Additive, and some cannot be what? Additive. Are you there? Are you there? Am I making sense? Am I making sense? Anything additive is a form of synergistic effect, because the two drugs come together to work. But additive focuses on what? Only on what? Therapeutic. What? Synergistic it can increase both the therapeutic and what? The toxic effect. Now, but in antagonism, one drug blocks the effect of the other drug. Are you there? In antagonism, one drug blocks the effect of what? Or the other drug. So antagonism is entirely what? Negative. Antagonism is entirely what? Negative. Do you know what this synergistic effect will help you to do? Watch now. Let me bring it down to the real life scenario. If the normal dose of a drug, is 200 mg, for example now, and the prescriber that knows about drug well want to prescribe, do you know what he will do? If he's prescribing it with a drug that have a synergistic effect together, do you know what he will do? You know that if he prescribes 200 mg, the effect will increase, but okay, maybe that drug has a very side effect that may not be good if it increased.
Admission. 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 Dear ladies and gentlemen, I bring good news. Admission into the diocese on the Niger School of Pharmacy Technician EENU Mission Hospital is on. The School of Pharmacy Technician (PhD) is an accredited tertiary institution that offers students a diploma degree to work in hospitals and pharmaceutical companies in order to promote safe and effective use of medicines at grassroots level. Graduates of Pharmacy Technician School EENU who wish to study pharmacy in the university can obtain direct entry into any university of their choice. The school has a well-equipped laboratory, comfortable hostel, and a healthy refectory. The requirements for admission are credit in English, mathematics, biology, chemistry and physics. In GCE, WAEC, NECO, NABTEB are not more than 2 sittings. The School of Pharmacy Technician (PhD) is located at EENU Mission Hospital, Agidi, Anambra State. For more information, call 0803 708 1512, 0813 868 2003, 0803 267 5322. Diocese on the Niger School of Pharmacy Technician. A tradition of excellence.